Hi, I'm Dr. Anantharaman R, consultant endocrinologist at Magna Clinic for Obesity, Diabetes and Endocrinology at BTM Second Stage, Bangalore. Kidney transplant surgery, more than the operation per se, the post-operative period is actually very important. So, in the post-operative period, typically we need to try and avoid all kinds of infections which can happen because of exposure to other infected individuals. So, you typically need to avoid crowded places and also use reverse barrier precautions. Typically, a person who has had a transplant and who's on immunosuppressant medication usually covers his face with a mask actually. And also it is important to make sure that you contact your nephrologist if you have any symptoms of fever or infection. Sometimes fever may not also be there at all times when it is associated with immunosuppressed state. So this apart, adherence with immunosuppressive medication is very important, because if you do not take the immunosuppressant medication, you may have a transplant rejection. So it's important to take your medication at the right dose as advised by your transplant physician. And also there is a risk of developing diabetes due to transplant immunosuppressive medication. So it is important to actually monitor yourself for the onset of diabetes by checking your blood glucose. So these are some of the precautions that you need to take after a transplantation. So regarding the second part of the question, whether the reproductive life will be affected, that is actually a very interesting question actually. For men, I suppose there will be no problem with fertility. Unless because once the renal function is restored, usually hormonal functions return to normal, and within a few months or years they will be producing normal amount of spermatozoa and normal testosterone levels are there, so which are adequate to have a child. But when it comes to women, they do not we are not sure whether pregnancy will be safe with immunosuppressive medication. So we may have to use safer immunosuppressive medication. So there are a range of immunosuppressive medication, and newer ones are being discovered on a yearly basis. In future, be possible for women also to carry through pregnancy with immunosuppressive medication.